We are going to be giving meds now. I have already assessed my patient. I have taken vital signs. I have assessed the need for any PRN medications that they might want. And I am coming to the med room. I'm going to wash my hands. And then look at my MAR, making sure that I have the correct patient. Their name and their date of birth are on there and are correct. I'm looking at their allergies to ensure that I'm not giving anything that they might be allergic to. I am looking at the time and determining which of these medications I need to give. Then I will pull the medications from our automated dispenser. Once I have what I need for each medication individually, I'm going to compare it against my MAR. So I'm looking at the name of the medication on the MAR and the med. I'm looking at the dose. I'm checking the expiration date to make sure they are not expired. And I am making sure that the route is correct. Once I have pulled all of my medications, I will grab any supplies that I need. I have already done my first check of my intramuscular medication. I have now found a quiet place to do my second check. I am looking at my MAR and verifying my patient's name and date of birth and their allergies, making sure that I have the correct medications for the correct time. And I'm going to do my second check here. I am comparing the name of the medication, stating that out loud on the MAR and on my medication. I'm checking the dose on the MAR and the dose on the medication and ensuring my route says IM and it is the correct frequency. I'm going to wash my hands. I have calculated my dose and I know that I need 0.5 milliliters of this medication. I will pop off this dust cap and clean the top vigorously for 15 seconds. While that's drying, I can open my syringe and get that ready. I am using a 22 gauge 1-inch needle. I'm going to pull air to 0.5, holding it right at eye level. Once that's dry, I can remove my cap, go straight in the middle of the vial and inject that air into the top of the vial. Then flip it over, making sure you can see your numbers, and pull up to 0.5. Check that you don't have any air bubbles in there, and you should not be touching the inside of the plunger, just the bottom. Once I have made sure that I have the correct dose and there are no air bubbles in there, I will recap using the one-handed scoop and make sure that it's on there tight. Then I will label my medication with the patient's initials, the drug name, the dose in milligrams, and the date and time that I have prepared it. Putting that out of your way so you can still see your medication. We'll dispose of my trash and go to my patient's room. I have knocked on my patient's door and entered, introduced myself, and explained what we are doing to my patient. I am going to clean my hands and do my third check. First, I will identify my patient by asking them their name and date of birth and comparing that against my MAR. And do you have any allergies? No. Okay, great. Now I'll check my medication using the vial that the medication came from, not my handwritten label. I will state the medication name on the MAR and on the vial, the medication dose on the MAR and on the vial, ensuring that my calculations are correct and I am giving 0.5 milliliters. I will double check the route is IM and that the time is appropriate as well as the frequency. I've explained to the patient using my drug cards what the medication is for and any possible side effects that they might experience. I'm going to collaborate with my patient on which site they would like to use, making sure that it is appropriate for the milliliter amount that I am giving. We can use the deltoid, the vastus lateralis, or the ventral gluteal. I'm going to position my patient so that they are comfortable and I can easily access the site and don clean gloves. Using my alcohol pad, I will clean the site starting with the center and working my way out. Let that dry without fanning or blowing it. Once it has dried completely, take off your needle cap, hold the skin taut, and inject at a 90-degree angle in a dart-like fashion. Slowly inject the medication and immediately safety your needle. I will then verify that my patient is okay. If there's any blood, I can dab it with a 2x2 or put on a Band-Aid. And I will dispose of my needle in the sharps container, wash my hands, and document my medication.